Everybody, good afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Sean O'Donnell from the Department of Health and Human Services, as well as Dr. Keisha Davis, who is the Acting Health Officer. Members of the media, remember to use the chat to request your permission to ask questions during the Q&A portion of this presentation. And good afternoon to you, Mr. County Executive.
Good afternoon, and thank everybody for joining us again today. This morning, we got a reminder that winter is here, and although we're not significantly impacted in Montgomery County, our neighbors in Frederick and Washington County caught the brunt of this storm, but some of the creeks in the county are running pretty high right now. This weather is a reminder that everyone should follow the latest county weather and traffic by signing up for Alert Montgomery text and email messages, or use our winter weather portal for the latest information when the weather gets bad. That way you'll have a better idea of if there are outages or roads get blocked, you'll have a better idea of where those things are. As a government, we plan, budget, and train to handle winter weather events and their impact throughout the county. Having our residents being prepared is critical, and communications is really important for us. So we appreciate any assistance you can provide by sharing or reporting on these resources that we'll be able to then put in a chat. So let us know if you see something that's out, if you see, a place where a stream is overrun a bank or roads closed. Any information you can provide helps us be more effective in our own responses here. I want to thank our transportation and department employees for their hard work. And we know that the weather can turn bad on us pretty quickly in this region, and they have to be prepared for the worst. One of the things we do in transportation is salt roads. And we are part of the Be Saltwise campaign. And it's to make sure that people, when they're using salt, don't use any more salt than they actually need to use. Salt is a pollutant and causes environmental problems. And early this morning, our transportation and environmental protection teams are up at the Salt Dome in Gaithersburg with media promoting Saltwise. And they got great coverage, and this message is really important. As the weather turns on us, you must expect some ice and snow covered sidewalks and driveways. When that happens, we often salt to melt the ice. Salting helps prevent slips and falls, but oversalting can be a disaster for the environment. Salt that runs off our streets and sidewalks winds up in local storm drains and then into local streams and eventually into either the Potomac or the Patuxent rivers, which are drinking water sources for 1.8 million residents of Montgomery County and Prince George's County. And salt can corrode concrete and masonry, harm pets, damage surrounding plants and lawns, and it also adversely impacts the water supply. So here are like simple tips on how to be salt wise. One is shovel right away. Don't wait to shovel. Get the salt, get the snow off as soon as you can. Use less salt, and it shows you that if you use, it looks like it's 12 ounces of salt, it'll melt 10 sidewalk squares. So I see a lot of people over salting, and you see mounds of salt on a sidewalk or on a road. The mounds of salt aren't helpful. They're not going to melt any more than they would if there was less of it spread out more evenly across the surface. And then at the end of all this, if you see salt on your sidewalks or your driveways, you can actually sweep up that salt and use it again. You don't have to brush it into the plants or on the grass or anything. You can actually sweep it up, put it back in a container, and when it snows or freezes again, take that container out and use the salt. As you cover winter weather events this season, and I hope you include these tips and messages along with your coverage. The media plays an important role in keeping people informed on things they can do and should do. And so we hope you let people know that they don't actually have to use as much salt as they think they do. Our public health date, before we get into those issues, one of the most frequent questions of these media briefings since Dr. Gale's departure has been who's going to fill his shoes. The process to find his replacement took a bit longer than anybody expected or anticipated, but it's great news that Dr. Keisha Davis began her first week as the health officer and we're happy to have her with us this week. I also want to bring attention to a letter to Larry Hogan, our governor, that I signed this week, along with county executives from Anne Arundel, Baltimore County, Howard, and Baltimore's mayor, and a number of advocacy groups. This letter was to request emergency funding for rental assistance. We asked for $175 million in funds. This would prevent the eviction of approximately 17,000 households. I was talking to somebody who works for the county in the eviction prevention process, and the number of evictions they've begun processing this fall is about 3 times the volume of what they were processing earlier. Not every eviction process leads to an eviction, but many of them do, and the county's resources are pretty heavily tapped out. One of the things the county had to do, because the limited amount of money we got, was that we limited rental assistance funds to households who had incomes below 50% of the area median household. So we didn't get enough money to provide all households with funds they would need to get catch up with their back rents. So we had to target the lowest income populations in that group. The more support we get from the state, and the more some people are able to return to work, hopefully the broader we can provide support to people in the community who really need it. So far, we've approved $91.3 million to nearly 12,000 households. I want to thank the HHS teams who've been working on this program over the last 2 years. And a lot of our residents have been helped, but there are still plenty who are in trouble with rising rents and housing costs. 11% of all the calls now coming into the HHS department are still regarding rental relief inquiries. And federal funds disappearing when it comes to rent relief is another reason why rent stabilization is something that we urgently need. The feds are rolling back their participation. They were not players in good times. They stepped in during the COVID crisis, but they're now going back to their normal position, which is not really to assist the county in dealing with this. There are too many tenants being squeezed by some landlords and raising rents beyond the cost of inflation. And while rental relief is not available anymore either, this is going to cause a greater problem for us. So hopefully the funds we get will enable us to serve more people. Hopefully the feds will take the approach they've done with testing kits, where they announced yesterday they would maintain testing kits through the winter. Hopefully the feds will take a look at what's happening with rents around the country and step in. There is a mismatch between rents going up and the number of people who are able to afford them. As for our case rates, the good news this week is that we're seeing a reduction in RSV cases, but both flu and COVID rates continue to climb. Additionally, our hospitals are under stress, especially in their emergency departments, but not only in their emergency departments. And in terms of COVID, we remain in the low community level according to the CDC, although our COVID case rate is comparable to the same time last year. We're also encouraging everyone to test before you go to your holiday gatherings. It's better to cancel plans than to get friends and family sick. So before you get ready to put on your jacket and leave the house, take one last test, make sure that you're not going to be going off with the COVID as a gift to your friends. And hopefully everybody stays safer and healthier through this holiday. But the most important thing you can do is to get your bivalent boosters and flu shots. I'm pleased that 57% of our residents over 65 have received the new booster. As a cohort, this is the most vulnerable to serious illness and death from COVID. Unfortunately, over 70% of eligible county residents still need their bivalent boosters. Sometimes the easiest way to find those who need these shots is to go to them instead of waiting for them to come to us. So this Saturday, we will be holding our 4th Boosterama at Westfield Mall in Wheaton. And the Boosterama will be from 10 a.m. to 1 p.m. And like I said, it's our 4th Boosterama. This weekend is the busiest shopping weekend of the year, so we expect heavy traffic and hopefully lots of interest. And Westfield Mall is also contributing raffle tickets for mall gift certificates to anybody who rolls up their sleeves. I want to thank our Department of Health and Human Services team, including our Latino Health Initiatives, Salud y Bienestar, Westfield, and Proyecto Salud for their continued collaboration and outreach. And creative ideas like Boostorama and partnerships like the one with Westfield helped the Montgomery County continue to lead the nation in vaccination rates. This is also our first Boostorama that we will also be giving flu shots at, and I'm interested to see the results. Our flu rates are nearing a record high, and we're just about to get into full swing of the flu season. So this may well drive higher, and there's concern that COVID will continue to spike upward. There have already been 10 deaths across the state this year due to the flu. Montgomery County recommends everyone 6 months and older get an annual flu shot. And as we highlighted last week when we had Dr. Damiano on, I remain seriously concerned about the stress that everything is putting on these emergency rooms and hospital staff. Finally, I want to thank President Biden and his administration for their COVID winter preparedness plan, as well as funding to provide a new round of at-home rapid tests that'll be distributed through the mail. All households can order a total of 4 at-home COVID-19 tests that will be mailed directly to them for free. In the absence of Congress providing additional funding for the nation's COVID-19 response, the White House used existing funding to add more at-home COVID-19 tests to the nation's stockpile and support this round of ordering ahead of continued increases in COVID-19 cases. So we want people to be prepared. Orders for this round of testing will begin to start shipping the week of December 19th and continue in the weeks ahead. We continue to take our own home rapid test distributions to make sure they're available, but it's helpful when families also take advantage of these federal tests so we can have our local supply last longer. Every home in the US is eligible to order a 3rd round of free at-home tests now. And we're encouraging all county residents to go to covid.gov/tests to order. And we hope that you get your share and you can share that site to your friends who may not know about this. Having said all this, I'm going to turn this over to Sean O'Donnell, and we'll take your questions afterwards.
Thank you, Mr. County Executive. Okay, to go through, just expand with a few additional numbers to ensure that all of our partners in the media and the public have awareness. What we've reported in the past few weeks continues. This is an overview of all of the different causes of febrile respiratory illness, fever, and cough or other cold-like symptoms or influenza-like symptoms, as we often call them. And the very light green is showing this year. You can see that we're significantly elevated for this combined set of syndromes over the last several weeks. And this is what has been stressing our healthcare system. It's not just COVID. When you look at the lower left, these are just emergency department visits, not necessarily over inpatient hospitalizations, but you can see our emergency department visits have been on average much higher than other parts of the year and on pace with what we saw last year during that incredible spike of COVID Omicron. When we look at the right, we've been showing you that a lot of this respiratory illness has been caused by our pediatric residents, the 0 to 4, the 5 to 17. We're starting to see those come down. This is likely linked to the decrease in RSV, which disproportionately impacts those ages as the number of cases. As you look, you see, though, the other age groups have started to elevate as well. And most notably, our 65 plus has elevated significantly for weekly visits for fever and flu-like symptoms. This is likely, again, RSV and influenza, as well as COVID. Very concerning because that 65 plus are the most vulnerable populations for serious illness and death for all three of those illnesses. What we do when we start to see the case rates rise, we look at a broader set of surveillance, and we like to share that with our partners. You can see we have been tracking some of the other cities on the East Coast, and our rates in Montgomery County have been similar to places we've seen on the East Coast, like Philadelphia, like our other jurisdictions. Of note, New York City has had a substantially higher, more than double the case rate than that we've seen here. And what we've noticed when you look back to the spike we had earlier this year in April and May, running through the summer, you can see that sometimes other East Coast jurisdictions like the New York City have that spike earlier than we do. So this has caused us to have greater concern and prepare as if our rate may continue to go up. You've seen it's after going up sharply after Thanksgiving, it's held fairly steady for the last several days, but we are prepared in case that goes up higher. No real change in the variant proportions. These continue to be subtypes of BA5. The bigger concern is that the antiviral treatments appear to still be effective. So we are encouraging people who are at higher risk for serious illness, including anyone 50 and older, to talk to their healthcare provider. If they have a positive COVID test, get in touch with your healthcare provider immediately to inquire about taking antivirals. They're readily available, and they're recommended for people at greater risk, but you need to start taking them soon. The greater concern now that we want to share is that some of these subtypes are showing there's less effectiveness of Evusheld, which is the treatment that is given to immunocompromised individuals prior to exposure. So we are sharing that so that those people who are immunocompromised will take additional precautions. Now, particularly if they've taken Evusheld in the past, it may not be as effective for some of these subvariants. As we look through, again, with our hospitalizations, we've seen an increase in the total number of people hospitalized. Fortunately, the setup we have in our county with the Adventist alternate care site in Tacoma Park operating, they are getting a higher number of transfers from the other hospitals, which is continuing to reduce the stress on our primary care hospitals. But we are noting these are increases in patients overall that are happening in our area. The mortality reports, we continue to see on average about 1 death a day attributed to COVID in our jurisdiction. It will likely be a bit higher in December. This is again why we're preaching all of these precautions. We would like to minimize as much as possible hospitalizations and deaths from COVID. And what we really need at this point is our residents to help protect those vulnerable populations that are in their family or that are their friends or neighbors or coworkers. Again, to give some perspective on it, these are the mortality data across the nation from pneumonia, influenza, and COVID combined. You see the wavy line at the bottom is the periodic threshold. It's higher during that, what we've called the influenza season, and lower during the summer months. And you can see up until COVID hit, the actual mortality data in the United States followed that pretty closely. Once COVID hit, those we saw spikes considerably higher than what we would normally expect, and not just during the what is normally the high point of the season, but also spikes during the lower point. So again, this is very important for us to convey out to the public that there is still a significant risk for death related to not just COVID, but influenza and other diseases. And the precautions that we take help to reduce all of these. So while we learn to live with COVID, we do want to continue to try to protect our most vulnerable populations. To that point, we are in this period with increased COVID activity, increased mortality, morbidity. So I wanted to highlight what HHS is doing with its partners in the long-term care facilities. Over the past few years, the long-term care facilities make up about 10% of the population, but unfortunately, closer to the upper 30% of deaths related to COVID. And so we're very concerned as our state and federal partners about how to try to control the outbreaks in these facilities. Our agency has 4 full-time members of our staff working with these facilities every day, helping to identify outbreaks, helping to provide guidance to reduce those outbreaks, limit spread. Our state partners have technical advisory teams that go out to facilities that are in outbreak status, as well as when they're not, to ensure that they're following the best practices to try to limit spread. As our county executive said, we want people to be very aware. It is important to visit your family members and your friends who are in long-term care facilities, especially like all year round, but I know especially during the holidays. Please, before you go, have a plan. Make sure all the visitors have gotten their bivalent booster. Make sure that you do the test before going. If you're symptomatic, even if your test comes back negative for COVID, you may have something else that could be deadly or serious illness to someone in those facilities. You're not just putting the family member at risk, but the other residents at risk, because the spread can continue on through the facility. And again, wear a mask whenever you're in these facilities in communal areas to try to protect and respect the other residents. This was just released today, and again, our county executive touched on this. There are additional at-home tests that can be ordered through covidtest.gov. Additionally, with the continuation of the emergency order, just wanted to remind all of our residents that Medicare covers the over-the-counter rapid test. All insurance plans are required to cover up to 8 free at-home tests per month, whether you pick them up at pharmacies or online. You can charge that to your insurance company, and that is covered as part of the federal mandate. And our partners, we talk about all the things we do locally. We do a lot of this resources provided through the federal government and through our state partners, whether it's having access to PPE or emergency ventilators if those systems get stressed, as well as putting out guidance through the Centers for Medicaid and Medicare to our long-term care facilities. And again, they are continuing to provide high quality masks, which we distribute the masks and the test kits out through our libraries, some of our rec centers, just reminding folks of that. Turning over to RSV, there is good news that these cases are finally coming down. This is showing test positivity has come down significantly. And even more importantly, our hospitalizations related to RSV in Maryland have come down very strikingly. I know when we presented this last week, we were a bit cautious about whether this was truly coming down. After 2 weeks of data, it very much appears that it is coming down. Looking at influenza, that's a different story. You see that we're at a very elevated amount of influenza activity. It started earlier this year than previous years, and it continues at a high level right now, likely because of gatherings people do indoors at this time of year. Hospitalizations continue to be high related to influenza. And as was mentioned, we already have 10 deaths that have been documented in the state. These are unfortunately likely to continue to go up as we go through this season. Finally, again, just an update on our influenza vaccinations. We're at about 32% in Montgomery County. While it's high compared to the rest of the state, it is everyone 6 months and older is recommended for an influenza vaccine annually, just like everyone 6 months and older is recommended to have a booster at this point for their COVID, a bivalent booster for COVID. Again, more good news on the Mpox front. Still no new cases in Montgomery County and only 1 new case across the state over the past week. So again, we're encouraged by the efforts being done to control this outbreak. At this point, I'd like to just ask if our health officer, Dr. Davis, has anything she would like to add, or if we'd like to go to questions.
Thank you, Sean. I think you hit the key highlights, which are really taking precautions before visiting family or joining gatherings, whether that's testing before you go. We encourage folks to wear a mask if you're going to be indoors with a lot of people, and certainly getting your booster and your flu shot if you haven't already. Keeping those key things in mind before you go to visit grandma.
Thank you, Dr. Davis. And my apologies to you. I think I called you acting health officer at the beginning. You're not acting, you're our official health officer. So thank you for joining us today for the first time on your official capacity. And with that, we open it to the Q&A portion of this presentation. Up first, Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Afternoon. This first question is for either of the health officials on the call. Obviously the county has put out kind of recommendations that people mask up in indoor settings, especially when it's crowded, and other precautions. And I just wanted anyone to kind of go through kind of the reasoning, even as cases are rising and stuff like that, the reason why not to mandate versus just strongly recommending. I just kind of the reasoning, I guess, behind that at this point, if that makes sense.
Well, I can share that we're at a point in COVID where we are trying to, again, educate and enable people to protect themselves. And what we've seen is with high vaccination rates, growing booster rates, a large amount of our population is able to live with relatively minor effects from a COVID infection. Where we're trying to stress is those parts of our population that are at greater risk for a COVID infection, and trying to tailor the protective actions to protect those individuals without significantly limiting other people's activities. And there are still some masking mandates in some of our congregate spaces when there's outbreaks. Those certainly happen. Those can happen in school settings. They can happen in a variety of other congregate settings. So it's not that there are not mandates, but they're really, we try to limit them to areas where there's greater risk for spread and there's greater risk for serious illness. And again, following CDC and state guidance, we're trying to ensure that if we don't see significant burdens on our hospital system or increases in mortality data related to the current strain, that we, again, try to empower people to protect themselves and limit the more serious illness.
Next question I have is kind of more broad, and I think it's mostly for Dr. Davis, who's I think this is your first week on the job, so congrats. But broadly speaking, as you're getting going here, what initiatives are you looking to kind of implement in the coming months, both through the executive branch and also working through the council? What's top of mind, I guess, for you at this point?
I think, as I'm getting in and really just kind of learning the lay of the land, certainly making sure that we've got a good foundation for COVID. So, all of the guidance that's here, but, one of the things that the county executive and I are both really passionate on is health disparities. And so looking at where those disparities exist within the county and how we can start to tackle them. And then again, as I start to learn the different systems where things need a special attention.
Just jumping literally off that, when you talk about health disparities, is it providing more service to those areas? Or are there other, like, in terms of actual policy? And I get that you're probably still devising this, but what do you mean when you, at this point, what do you mean further addressing those?
Sure. So, when you think about health disparities, there is the looking at specific health outcomes. And so understanding those, looking at things like cancer rates and chronic disease rates, and how do you tackle those? And part of that is an access issue, but part of it is also looking at health in all policies. And so the underlying issue in some part may extend beyond just what happens within the healthcare provider's examination room. And so how we look at some of those broader policies that also impact health and what those downstream effects are. And so it's looking at it at multiple phases along that trajectory. So not just looking only at that ultimate health outcome, but what are some of the steps and things that systemic issues that might have led to that disparity existing in the first place.
Thank you, everyone.
Thank you, Steve. Up next, Darcy Spencer, NBC4. Good afternoon, Darcy.
Good afternoon. My question is for County Executive Elridge. Just following up, this week you may have seen some of us were back out at the explosion site at Potomac Oaks in Gaithersburg. And there's a lot of concern among some of the displaced residents that I know it's very complicated and very layered, but you don't hear people criticizing the county like what we were hearing on Monday about people kind of being left out. There's issues about housing. Some of the folks, you know, they're out of their homes.
Yes.
They're in limbo, so they don't know, like, do I get a new place to live, or am I going to be able to go back home? There's issues about affordability. You know, they were in a situation that they could afford. Now they're out there. They have children who may go to a school, you know, based on that where they were living, and they don't know if they're going to be able to continue that. We're hearing a lot of different things. They're saying they can't go back and get their belongings. I'm just seeing, you know, as the county executive, what can you say? Is there anything more the county can be doing to help these folks?
So if they've limited people going back to get their belongings, it's because the buildings themselves are not considered safe. And so we don't want people going in and then triggering a collapse of a wall or something that would put these people in danger. So I know it's hard to be without things, particularly when you realize your unit wasn't completely destroyed and there may be things in there. But whatever they're doing on the basis of trying to protect people's safety. There's no other reason for doing it. Now we will continue to, I will raise it with them again about what they anticipate in terms of allowing people back in to some extent into buildings that are accessible. On the bigger picture, this was a condo. These are owned properties. These aren't rental properties. How the condo association rebuilds the building is something that, you know, the county government doesn't normally get involved in. We would expect, and as has happened in other buildings where, like the Flower Avenue fire, probably the biggest example of this, we were able to actually replace the building that exploded and burned down. So I would anticipate that in the middle of a townhouse development, there's going to be an ability to do that. And the owners are in a different situation than the renters. They actually have a stake in the projects, but maybe our folks could provide more information on what the difference of their role will be in ownership rather than just being tenants in a property. But the county doesn't control when it gets rebuilt. We do control when the site's ready to work on again, which will be when they feel that it's been safely been safely removed.
Sorry, just to follow up to that, because you can see the property is pretty much the same way it was, you know, within a couple of days after the explosion. The fence is up, and you know, from the outside perspective, it looks like nothing's happening. And there's questions about permits and things like that is where it gets kind of complicated. Do you know if any of this process involves county agencies as far as getting a permit to do anything there?
It's City of Gaithersburg. So
okay, because we're hearing different things.
It is in the City of Gaithersburg, and they have permitting. I can find out if there's an overlap with us. I don't believe that we're holding up any permits. There wouldn't be a permit for new construction because there's no architectural plan, drawings, renderings, and engineering work that's been done on a new building. So I would not expect to see something new going up until they figure out the fundamental question of who's going to rebuild the building and when is the building going to get rebuilt. And like I said, then there'll be issues involving what are the tenants entitled to once the building's rebuilt.
Okay, and then just regarding the housing, Is that something HOC is involved in? I know it's a little complicated, given that it's ownership versus renting, but some people were renters there. They may be in the worst situation because they were renting from an owner.
Well,
But is there assistance? I know there was a fund with over $100,000 raised. Like, are those monies going to the people?
those monies are going out to the people. I don't know what the status is for everybody, but I thought that most of the housing units had actually been, and let me check this note I've got. For rehousing, though, my note says for rehousing, we've been provided first month's rent and security deposits for people. Assuming that they were paying mortgage or rent before, the assumption is they'll pay rent going forward until the units are replaced. But we've been housing people, and we've been providing support for them. So I'd have to know more about what individual specific issues there are. I get not knowing what comes next because it is a complicated thing when one part of a building falls down and tenants have ownership in the units that aren't there, but have no ability to just say, I'm going to build you're not going to build a new unit, you have to build a new building. So I get that it's complicated. And I will talk to my people about seeing if we can provide them with more information about what the likely path forward is and what kind of support we would continue to provide. It doesn't make any difference for our purposes whether they're renters and owners, by the way. If they lost their units and they don't have a place to be, wouldn't make a distinction between whether you're a renter or you're an owner in this case.
Can you say anything about the affordability issue? I guess that's just an ongoing problem that, people deal with as far as trying to find affordable housing.
Yeah, I mean, I would hope that when they get their units back, whatever form that takes, that the units come back affordable to them as they were before. After all, this should be insured. But as far as rents go, I mean, unfortunately, we're in a period of accelerating rent demands, and there's not a lot we can do. We've put forward legislation that would continue the cap for 6 months. We're going to be proposing something more permanent, but until something's in place legislatively, we'll provide what we can in terms of support, but we do worry about, where people are going to be able to find housing.
Thank you, Doris. Thank you, Darcy. Up next, Suzanne Pollack, MCM. Evan, you're next. Good afternoon, Suzanne.
Hi, thanks so much. Mr. Elridge, I just wanted to find out if if there's had been any restrictions or if you've had to pull your, you had made a ruling a while back that no trips from officials could go to states or conventions to states that don't allow abortions. And I was wondering if anyone has tried to or have not gone to conventions, or what the status of that is.
So near as I know, that some things have not been approved, but some things have been approved, where the trainings were deemed to be necessary and unavailable in another location. We've let people go for trainings. We said we would not handicap our ability to train people.
And does that also include the school board?
But we don't control the school.
You don't. That's what I thought. Okay, so just
that.
Yeah, I did. I just wanted to know if this policy also. All right, thank you.
Okay.
Thank you, Suzanne. Evan Kosla, WUSA 9. Good afternoon.
Hey there. Thanks for doing this. First thing I just wanted to ask on the COVID front, and this is for Mr. Elridge. You guys were recommending wearing masks yesterday in public places. Mm-hmm. Is there any consideration to do a mask mandate in public places, including schools?
As far as I know, there's not a consideration of doing it now. And Dr. Keisha, you can fill in here, but
no, that's correct.
Conditions.
We are not recommending a mask mandate at this time. I think Montgomery County residents ask what they can do to be helpful to reduce the spread, and voluntarily masking up in congregate settings, or when you're going to be around high-risk folks or in places that with limited social distancing, that we know that a mask can be helpful if you especially if you are someone who is experiencing symptoms, wearing a mask is helpful, but certainly offers some protection to the wearer. So voluntarily encouraging folks to wear a mask when they can, when they're in those situations, but no mandate at this time.
Just to follow up on that, I think I can speak for a lot of the population when I say people are just sort of over masks. Does that make you guys worry that with the holidays, people going home, a lot of traveling, that we're going to see a boost in the area? Perhaps this is for you, Ms. Davis.
Certainly. I mean, certainly that's why we've issued this advisory, because we are concerned that as traveling and increased holiday gatherings, that folks are going to be around people that maybe they haven't been, or be in spaces with more people than maybe they have been typically. And so issuing some of these precautions, certainly getting your booster and flu vaccine, but also taking advantage of testing before you go, opportunity to limit your own spread of COVID if you should come in contact with it, and be willing to change travel plans. We are, as was mentioned earlier, we tend to run a few weeks to a month behind New York, and we're really trying to encourage folks to do their part to prevent our spread from getting higher.
If it's okay, I have one other question that's not related to COVID or flu or anything like that.
Sure.
Mr. Ehrlich, I just wanted to ask if you knew of any progress on filling the positions for the planning board after members resigned.
The county council has not said anything. I know they've requested submissions for applications, but we haven't gotten any update on where they are in that process or when they plan on start holding interviews.
That's it for me. Thank you.
Okay.
Thank you, Evan. I do not see any more requests for questions from members of the media on the chat. Any other questions, reporters?
Sorry, can I jump in here, Laura? Sorry.
Yes, go ahead, Steve.
Mark, on that last question, I believe Mr. Zions and another member are going to be permanent members, and then the three. I just want to get your thoughts on.
No.
And obviously, Mr. Zions has been around for a while. I just want to get your thoughts on the fact that two of them look like they're going to be permanent members.
I don't believe that they are. I mean, I talked to Jeff a couple of days ago, and Jeff Zions, and Jeff said he's no intention of being the permanent planning board chair or permanent planning board member.
Okay, I guess you have more recent information than me, so that's all I had.
I had another quick question. I don't know if Mr. Ulrich could comment on it or not, but there's a legal challenge now to the county's attempt to limit guns in public spaces. I know that's a legal issue, but that was something that was done. And go ahead.
I'm aware of the lawsuit. I wish them that they fail. It would be really bad. The idea that people are encouraging people to walk around with guns is just flat out nuts. This is not the Wild West. This is not some lawless, anarchic country where you have to watch every step and have a gun ready to pull. Encouraging people to walk with guns and to encourage the mentality that you might need the gun to defend yourself is just an invitation to trouble and an invitation to more death. And it's really sad and in a way pathetic that people feel like the only way they can, demonstrate their ability to be safe is if somebody knows they're packing a pistol. It's sad, it's not good, and I hope they fail.
Thank you.
Thank you, Darcy. I don't see any more questions. Members of the media, going once, twice. I guess we're done for today. Thank you, everybody, for joining us. Have a great afternoon and stay safe.